Eye problems can be challenging. Tonight on Doctors on Call, we're talking about cataracts, contacts, glaucoma, macular degeneration, and other eye problems. I'm Dr. Ruth Westra from the Department of Family Medicine and Community Health at the University of Minnesota Medical School, Duluth, and I'm your host for tonight's program. We're ready to take your questions about vision and eye problems. Just give us a call locally at 218-788-2844 or toll-free at 1-877-307-8762. I'm pleased to welcome this evening's panelists, Dr. Charles Ahrens, an ophthalmologist with Relf EyeCare Specialists in Hermantown, Dr. Angela McAllister, an ophthalmologist with Essentia Health-Duluth Clinic, and Dr. Kevin Treacy, an ophthalmologist with St. Luke's Ophthalmology Associates in Duluth. Our medical students are waiting to take your calls tonight. They are Josh DeGallier from Winona, Minnesota, Laura McDowell of Hastings, Minnesota, and Sarah Vernig from Onamia, Minnesota. And now on to tonight's program on eye problems. So Dr. Treacy, we have a model here. Do you want to walk through some anatomy of the eye with us to start?
That's a good starting point, okay. Sure. It's an amazing organ. It's not very large, of course, but very complex. And I think a good analogy is to think of it as a camera. Light comes in and it needs to be brought into focus. And so if we take a look inside the eye, we can see there's two major focusing elements. There's the front part, the window of the eye called the cornea, and then behind that, and also behind the colored part, the iris, is the lens, which starts out for most people in life clear. That can become cloudy, and that is what is known as a cataract. But the goal again is to bring things into focus on the back of the eye, which is the retina, and then the electrical signals are transmitted back to the brain along this nerve, the optic nerve. There's about 1.2 million nerve fibers going back to the brain where the images are interpreted, and that's what we have as vision. It also has a number of eye muscles that insert 6 eye muscles on the wall of the eye, and those help turn it in different directions.
Well, thank you. We'll kick off with just some questions while we're waiting for the questions to come in. So, Dr. McAllister, talk to us a little bit about cataracts. What would be symptoms of cataracts?
Okay. Well, as Dr. Treacy mentioned, the cataract is a clouding of your lens that happens over time, and some things that can cause cataracts to occur faster are sunlight exposure, smoking, diabetes, things like taking steroid medications over time. And basically, when the lens becomes cloudy, you often have decreased vision. This is often people notice things like glare with night driving, and headlights on cars can become more like starbursts. Sometimes reading and seeing fine print, small things like needlework or threading a fishing line can be difficult as well. But basically it's usually a gradual symptom that occurs over time and causes decreased vision. So those are the symptoms.
How about age-wise, Dr. Ahrens? Is there a certain age when cataracts start to develop?
Well, technically, most people, when they hit about middle age, about 40 to 45, they start noticing that they have trouble seeing up close. And that, most of us think that the process that's going on is that lens is getting more and more solid, and so it's more challenging for us to focus light up close. And so technically, that's probably when the cataract is starting. I generally will tell my patients that, I can start seeing it, on my exam at about age 50. But again, like Dr. McAllister said, it's a gradual progression. It slowly gets worse and worse and worse. And usually we don't have to start dealing with things such as cataract surgery until later on, usually I would say probably average about 65 to 70 years old, somewhere around there.
And then common surgeries, how would the surgery potentially be performed, Dr. Treacy?
Well, the idea is to remove the cloudy lens and put in a clear lens. And so over time what has happened is we have stopped taking it out in one piece, which required a large incision across the edge of the cornea. Now we can do this usually through about a 2 millimeter incision, and now we break it up within the eye and it gets aspirated out. And then these implants are marvelous devices. They will fold up and go through that same small incision. And the goal is to put it right where the cataract was. There's a bag in there that held the cataract. Now it holds the implant.
Fantastic. Well, Dr. Ahrens, a caller from Grand Marais, asking about floaters.
Okay.
Maybe a description of floaters and if there's any treatment.
So actually that's interesting because we just had my partners and I were just talking about this. So floaters are those things that we start to see kind of normally about middle age and on, where you start to notice the little flies that are buzzing around you and you think there's a fly, and people start thinking that they're going crazy because they see these all the time, or they're big wavy wasps of gray or black or sometimes even brownish color. And they just kind of sit there in the middle of the vision. What's actually happening is the gel in the back of the eye, which is normally attached to the retina, as it liquefies as we age, starts to separate off of the back of the eye. And when it separates, now instead of looking through a clear stretch out sheet of cellophane, it pulls off and it crinkles up and it floats back and forth. And that's what they're seeing, you know, with that perception of the little bugs or things like that. What we have to be worried about as ophthalmologists is when that separates off, it can actually tear the retina. And so if it tears the retina, fluid that's back there can tuck underneath that tear, lift the retina off, and cause a detachment, which is obviously not great for vision. As far as treatment, if it's just the floaters, generally, if it's not bad, and patients will adapt to this, usually it takes a while. It takes a few months for patients to adapt, and the brain kind of just gets used to the fact that it's there. We just leave it alone. You can do a surgery to remove it. Now there are some lasers that potentially can break up those floaters, although a lot of those are still kind of in the study phases, and a lot of that's kind of newer technology that's coming out. So there may be something down the pipeline, but it's not quite standard of care yet for that. But there's a little bit of hope for those.
Excellent. Well, Dr. McAllister, a caller from Duluth asking about tear duct plugs. Is there any way to get rid of plugged tear ducts?
Okay, so the tear duct, the question is that their tear ducts are
Kind of plugged or feeling like there may be more tearing happening or something.
okay, so they're tearing. Okay, so well, there's lots of causes of tearing, and you know, it's sometimes we have to examine patients to really determine the exact cause. But one of the major causes of tearing, and it might sound counterintuitive, is actually dryness of the eyes. Because when your eyes are dry and irritated, you have nerves in your eyes that kind of tell your glands to make more tears. And so consequently, you have more tears and more tearing. So sometimes more tearing doesn't necessarily mean that your tear drainage system is plugged. However, that being said, the tears normally, just another anatomy point, they come from your lacrimal gland up here, and then they can drain down through the tear ducts into your nose. So often you notice if you're tearing, you might have a runny nose. So I guess that's kind of, as far as if the tear ducts are plugged, there are ways we can open them and improve that drainage system.
So, Dr. Treacy, this is an interesting caller asking about lazy eye. What causes lazy eye? Is it inherited? That's the question from Duluth.
That is a very good question. Lazy eye, many people think of it as being the eyes are deviated. They're turned in or they're turned out. But actually, that's just one cause of lazy eye. We think of lazy eye as one eye does not see as well as the other eye. And it needs to be detected early in age because then it can be reversed. Beyond a certain age, the success of treatment goes down. And different causes could be an uncorrected refractive error. So kids that are nearsighted or have astigmatism can develop lazy eye. There can be something wrong in the eye. There can be a cataract or problem elsewhere in the eye. So any concern about a child's visual development deserves an examination to see what's going on.
Thank you. So, Dr. Ahrens, a caller from Duluth asking about blepharitis. If there's a treatment or cure for that.
That's another great question because I see this probably, I don't know what you guys see it, but I would say 70% of my patients. I mean, it's very, very common, especially in northern Minnesota here. And you know, we were talking earlier. Yeah, as we get closer to winter, we're seeing a lot of it. What blepharitis is inflammation of the eyelids, and you have little oil glands that secrete oil onto the tear film, and it kind of answers to what Dr. McAllister was talking a little bit. Those oil glands secrete oil that help protect the tear film from evaporating off, and when there's inflammation on the eyelids, those oil glands can get clogged up, the oil is secreted irregularly, can irritate the skin, cause itching, burning, dryness, and all of those things. And so a lot of times when patients come in with this, my initial treatments would be things like warm compresses or hot compresses, and the reason why is because if those oil glands are getting clogged up with a solid state oil, we wanted to make it a nice liquid state oil and get it to secrete better. A lot of times if there's inflammation, we can use certain medications or even some massage and maybe even shampoo on the eyelashes to help kind of give it a better environment, a better lid environment and tear environment. And so those are kind of the starting treatments, and then we get a little bit more complicated as we go on to try and fix the problem.
Excellent. Dr. McAllister, several questions about macular degeneration. And we have this kind of concept of wet and dry. Maybe a description of the difference between wet and dry.
Okay. Well, macular degeneration is a condition that affects mainly people that are over 60, primarily over 60, and it's really most prevalent among Caucasian populations, similar to populations in this area. And what it affects is basically the back of the retina, as we saw with this eye model. In the center of the vision, there can be these small sort of proteins that build up with time. And we can see those on our exam, and when we see many of them of various sizes, we call that the dry macular degeneration. Now, sometimes there can actually be sort of a new blood vessels that grow behind that and can bleed into the back of the eye, and that's the wet form. So it just means that there's been some bleeding in the back of the eye.
Do we have any medications that we recommend for macular degeneration? Or treatments from either of you? Or?
Yeah, so
Continue on.
For the dry form of macular degeneration, once it reaches sort of a moderate stage, we do recommend eye vitamins. There have been studies to show that the eye vitamins, I don't want to endorse any products, but you can find them at your pharmacy, decrease the sort of progression of the disease, so it sort of slows things down. Another really important thing to do is to quit smoking, because smoking worsens it as well. For the wet macular degeneration, we do have medicines that sort of stop those blood vessels from growing and bleeding that we use in clinic, and we put this medicine in the eye itself. So.
And if I can add one thing about the multivitamins, at least in my practice, I find it's really important to note that what the studies show as far as the multivitamins, there's a specific formulation called the Ahrens formula, age-related eye disease formula, versus the other eye multivitamins out there which are not proven to work. And so most of us will be recommending, if you come in and see us, that's what we'll be recommending. And so if you do have questions about whether or not you're taking the right eye vitamin, it's good to talk to your, update yourself with your doctor and make sure you're on the right one.
Yeah, I usually have a handout with the ingredients that I would recommend. So.
Yeah, that's very helpful. Well, Dr. Treacy, a caller from Duluth, asking about the eyes are stuck shut when they wake up in the morning, and during the day then the eyes are very red and watery. What is this, and what can be done for that?
Good question. And Dr. Ahrens already touched on the concept of blepharitis, and these would be signs of inflammation along the eyelids, but it can primarily come from the outer layer of the eye called the conjunctiva. So what we think of pink eye conjunctivitis, especially in the children, often will present with these sort of mattery, stuck shut eyes. So whether we're dealing with an acute or a chronic presentation may dictate, is it blepharitis or conjunctivitis, and the treatment can be different for each.
Okay. Dr. Ahrens, a caller from Poplar, asking about corneal degeneration.
Okay.
Any treatment recommendations for that?
That's a good question.
procedures?
Number one, I really like the Poplar Golf Course. I grew up golfing there, and I really like the golf course. As far as corneal degeneration, there's a lot of different types of degeneration and dystrophies, and depending on the specific cause, there may be treatments and there may not be treatments. So this is kind of me not answering the question fully, but it's really kind of tough to answer that question without actually seeing what type of degeneration it is, what type of process is going on. Has it been lifelong? Is it acquired? So I'll just answer with there's a lot of different degenerations. There may or may not be treatment depending on what that is.
Dr. Treacy, this is kind of a fun call from Duluth. Athletes, they wear black streaks under their eyes. Any purpose for that, or why are they doing that?
Well, the idea is to reduce glare that might be coming from their skin, and if it works, go ahead. That's not going to hurt the eye. I don't know of any studies that say that they perform better, but psychologically, if it helps, do it.
I just thought it was to make them look tougher.
Yeah.
Well,
I'm just kidding.
that
really
may be
sure.
the main benefit of it. Yeah.
Well, Dr. McAllister, a caller asking about drooping eyelid. Any treatments or recommendations for drooping eyelid?
Well, again, there can be several causes of drooping eyelids. Sometimes they can be just a matter of time has taken its toll and your eyelids become droopy. There can also be some medical conditions that can cause drooping eyelids. So the kind that sort of comes on over time and maintains, like it is more constant and more droopy with time and doesn't really change much, is often the one related to sort of aging, and that can be fixed with surgery. Often we can repair that and lift the eyelids up. So,
Dr. Treacy, a caller from Babbitt asking about iritis. Any long-term effects from that?
Yes, that's a good question. It's something we all see in our practice on a regular basis, and there's different degrees of inflammation. Iritis refers to inflammation inside the eye, so not on the surface, but another cause of red eye, and potentially serious, potentially blinding condition. It can be associated with elevated pressure, such as a secondary glaucoma. So that's why I think it is important that anyone presenting with a painful eye, light sensitivity, redness, needs to have that looked at.
Dr. Ahrens, a caller from Keewatin, asking about Sjogren's patients.
Okay.
Probably dry eyes, or what it would be associated with Sjogren's or a connective tissue disease.
Right. So Sjogren's disease is an autoimmune disease, and basically the body is mounting an immune response on different parts of the body. And with Sjogren's syndrome, it's more specific to the eyes and to the mouth. So these patients will often have severe dry eyes, severe dry mouth. And these are patients who are a lot harder to treat with the standard dry eye treatments. My bottom rung of the ladder on my treatment scale just doesn't usually work for these patients, and it's a little bit more severe. And it's important to treat these patients because if you don't treat dry eye appropriately, later on in life it can lead to scarring and maybe even lead to permanent vision loss. And so it is important to identify these Sjogren's patients early, get them in with their primary care doctors or their rheumatologist to treat the autoimmune aspect, and then from our standpoint, treating the dry eye aspects that may be associated with it.
Nice. Dr. McAllister, caller from Duluth, asking about night vision decreasing, and any relationship or why that happens or occurs for people?
Well, there are many reasons, obviously, that night vision can be decreased, but I think one of the most common reasons is that their glasses prescription is often not strong enough. So oftentimes people, especially that are nearsighted, or in other words have trouble seeing in the distance, if their glasses aren't strong enough, sometimes that can cause them to have a little bit more difficult time at night. And sometimes it can just be a matter of, other conditions, which I won't elaborate on. But
Well, thank you. So, Dr. Treacy, how about blood clots in your eye? How are they treated, and will vision be restored? That's a tough one.
Yeah, that is a dilemma at times because some of the treatments are rather emergent. The main question we're asking ourselves is whether this is affecting the artery going into the eye or the veins that are draining blood away from the eye. And if it's an arterial obstruction, specifically the main artery, the central retinal artery, if that's blocked, we try to establish, is that due to a clot that traveled to the eye, or is it due to inflammation? And the treatment is going to vary, but we do want to start treatment right away in the hope that it will help.
Well, Dr. Ahrens, there are a lot of questions tonight.
That's good.
Caller from Superior asking about ruptured globe. Yeah, everybody kind of goes, whoa.
Ophthalmologist's worst nightmares.
Yes.
That's a ruptured globe.
Are you guys on call right now?
Will you regain your eyesight with a ruptured globe if there's been a trauma or injury?
So a ruptured globe is any time that the eye itself opens up. So you can kind of think of the eye as a little water balloon, and if you puncture a hole in the water balloon, that's kind of like a ruptured globe. And so, I think we've all had ruptured globes where whatever the trauma might be, if say a nail or something may be small and enters into the eye, we may be able to save the eye. If it's a very significant trauma, and depending on the damage, we may not be able to save the vision. Most of the time when I approach these patients and I'm seeing them in the ER and I know they have a ruptured globe, regardless of what their vision is and how they're doing, I tell them this is a potentially devastating disease, because it is. Even the smallest little opening in the eye could lead to later on scarring, retinal detachments, and other problems that later on might lead to vision loss. So it really is dependent on the amount of trauma, the type of trauma, where it's been affected, how quickly they're seen, and things like that, and what kind of surgical things we can do to repair those.
Pretty devastating too. Dr. McAllister, a caller asking, why do you have to go see the eye doctor once a year if you have diabetes?
Okay, that's a good question. So diabetes can affect the eye in many ways. It can, as I mentioned before, it can increase cataracts, but it also can cause new blood vessels to form in the back of the eye, and abnormal blood vessels to form in the back of the eye. And this is because in diabetes, the eye is not able to get enough oxygen where it needs to, and so sometimes it just kind of makes new routes. And those routes, those new blood vessels are abnormal, they're often leaky, and it's a gradual process that occurs over time, but we can kind of predict the risk of vision loss, and we can titrate treatments based on the progression. And of course, it's, the better you control your blood sugars, the less likely you are to have this progression.
Well, Dr. Treacy, we'll probably end with this one. This is a caller from Virginia asking about why we don't recommend more hats with brims versus sunglasses. So is there a difference for protection of the eyes with wearing sunglasses versus hats, or is it help at all?
Do both of them, yeah. A lot of the sunlight exposure, which we know can lead to cataract, as Dr. McAllister mentioned, it can also lead to cancers of the skin, and a lot of it will be reflected off of the surfaces around us, and so having sunglasses may provide a little protection. Having wraparound will do even better. But the brims are certainly, I think, help wide brim hats with comfort, and so I'd say err on the side of a lot of protection.
Excellent. Well, thank you all. I think we want to thank our guests for all the participation that we've had and all the many questions that we've had. We would truly want to thank our viewers as well. So I want to thank our panelists, Dr. Charles Ahrens, Dr. Angela McAllister, and Dr. Kevin Treacy, and our medical students, Josh DeGallier, Laura McDowell, and Sarah Vernig. Please join Dr. Alan Johns next week for a program on upper GI problems, when his panelists will be Dr. Bradley Irwin, Dr. Thomas Nelson, and Dr. Teresa Smith. Thank you, and good night.